All right, good evening, everyone. I hope you are doing great this evening. I'm sorry that we're starting late, and this is 10 minutes past 6. Of course, the network challenge everywhere around the country is affecting everyone. Today on the call, we're going to look at the Nigerian health system in the era of economic downturn, issues, challenges, and way forward. Of course, this is brought to you by Dr. Mezie Okolo Leadership Academy. And today we have our speaker, Comrade Echezona, Asuzu, who is going to actually do justice to this topic. And of course, Dr. Mezie Okolo will be our host. He's going to have the major interaction with him. And of course, if you are in the health sector, this topic is a very important one, and I believe that wherever you are, you pay attention to this. And of course, if you are listening to this through the recorded section, maybe you can drop your messages through the next social network where you see this. All right. Thank you for everyone for joining. I'm going to hand the mic over to Dr. Mezie Okolo for the introduction. Good evening, sir. Are you on the call? Dr. Mezie, can you hear me?
Yes, I can. Thank you, everyone, for joining the call tonight. We have a little technical issue with the network system around here. So we're going to see how we can roll with it. Comrade Asuzu is here with us today, and we are looking at the Nigerian health system in an era of economic downturn, the issues, the challenges, and the way forward. And I'm going to be turning the microphone to Eche. He will probably have for about 30 minutes to make his presentation, and then we will engage him on the content of his paper and see how we can bring out issues around the health system and the health of the health system in the Nigerian in Nigeria, given the economic situation. Comrade Eche, please, the microphone is yours. Thank you.
Comrade Eche, can you unmute yourself? I think we can. Don't seem to hear you.
Okay, thank you. Thank you very much. Sorry, I thought I'd unmuted myself. I want to really thank Dr. Mezie for inviting me to this space. Quite an auspicious space for leadership development and capacity building. I followed the series for some time, and I can say that this is the kind of thing we need in this part of the world to actually discuss and build our capacities to be able to understand what the issues are and be in a position to prefer very germane solutions to identified concerns. So once again, I want to thank Dr. Mezie and the Right Place for initiating this very laudable program. Straight to the issue of the day is the matter of the Nigerian health system, especially at this time, what we classified as an era of economic downturn. What are the issues? What are the challenges? And what could be the way forward? I must say that this presentation or this talk today is derived from a discussion that took place among a conference of health workers, and we're looking at some of these issues, health workers of all, all over the country. And it became an ongoing concern. And I'm happy the Right Place, given their concern for the health of the people, health of Nigerians, decided to also amplify some of these issues and then have a space to discuss them. So we are looking at the health situation in Nigeria at this time of economic trouble, economic difficulties. What are the driving factors and how can we tackle them? First is that it's important to look at the keywords. Nigeria is a keyword. What is Nigeria? Nigeria is a country situated
Hello, sir, are you there?
Like yeah, I'm here. Sorry, a bit of a glitch from the internet. Sorry for that outage. So as I was saying, Nigeria is situated between Sahel to the north and the Gulf of Guinea to the south. It's a multi-party democracy, a large country covering about 923,769 square kilometers. It's a population of 230 million people, at least according to the estimates by the United Nations Population Program. You know, it's estimated that by July this year, Nigeria will hit 230 million people. Currently, we're about 229 fraction million people. So Nigeria is the most populous Black nation on earth. There is a saying that you cannot see a conglomeration of Black people in any part of the world than you see in Nigeria. You cannot see a sea of head of Blacks anywhere in the world like you see in Nigeria, because we're the most populous Black nation on earth. And I think it's something that we can actually turn to our advantage if we are strategic enough. And in the course of this presentation, we can see why we have not been able to deploy that kind of strategy to turn the different levels of our economic engagement around, especially in the area of healthcare. Nigeria is home to 250 different ethnic groups speaking about 500 distinct languages. Historically, Nigeria has been the ancestral home of several indigenous pre-colonial states and ancient kingdoms of renown, including the Kanem-Borno Empire, the Fulani Caliphate, the Benin Empire, Oyo Kingdom, and so many very, very ancient kingdoms that have demonstrated different epochs in civilization. As it is, we understand that we have had a number of very great achievements from pre-colonial times. We're talking about the North civilization, or the North culture as it is called, that exists in the north central parts of Nigeria. That's been so old, thriving 1,500 years before Christ was born. So you can see that where we are coming from as a people, we're people of great pride, we're people of great achievement, we're people before the colonial masters came. We've already gone far in terms of civilization. We have other kinds of civilization like Iwoku, Nri, Benin, Ife civilization. In fact, in their paper, we have a number of scholarly documents internet concerns. Sorry, you know, we have internet challenges all over Africa due to the subsea pipeline communication pipeline vandalization, the cable vandalization that took place somewhere between Senegal and Cote d'Ivoire. We are all suffering from that issue. So please, if you have outage, please bear with us. If you are finding it hard to connect, please bear with us. is just some kind of force majeure, you know. So as I was saying, some explorers who had navigated this climb, different parts of this region, have documented their experience, their encounter with the ancient civilizations in Nigeria. Olfadapa, who was a Dutch doctor and writer, took an account of what he saw when he came to the ancient city of Benin as far back as the 14th century. Also, Lourenço Pinto, who is a Portuguese sailor, also documented likewise what his experience was when he came to this pass in the 14th century AD. Also in the book, How Europe Underdeveloped Africa by the Guyanese revolutionary scholar, Mr. Walter Rodney, a very graphic account of the description of the civilization we saw in Benin, not just in Benin, but also by extension to other civilizations, other kingdoms in Nigeria. In Benin, it was said that that the streets were so well planned that they were better than some of the European cities of that time. You know, the description gave us an idea of the wide boulevards, wide streets, well-planned streets, districts. The city was divided into districts as if it was the work of a sophisticated architect or town planner. We had street lights in Benin lighted with great tech. That time they had the palm oil wick technology. Nobody taught the Benin Empire. This was a homegrown technology where they had street lights, well-lighted streets, well-organized society that was crime-free, and a very great advanced indigenous administration led by the Oba, his princes and chiefs. So in Nigeria, we've come a long way. So we're talking of a great country. We're talking of, when we say we're a great country, we're looking at the rich rich vein of our diversity, of our culture, our rich cultural heritage. We also had other kinds of evidences that show the level of sophistication in our pre-colonial history. We have the narrative of thriving medical care, medical health sector. We had all kinds of specializations in our medical care. We had surgeons, we had bone setters, we had diagnostics. We had nurses, we had midwives, we had all kinds of sophisticated specialization in our pre-colonial history. And in other areas, other industries and areas of life endeavor, like craft, entertainment, woodworks, pottery, the one the Igbos call nka, blacksmithing, weaving, textile, manufacturing, making, name it. There was a lot of advancement in our way of life, in our culture, and in our industrial, maybe not industrial in the sense of industrial revolution, but in our application to entrepreneurship, in our application to manufacturing, in our application to production. There was a lot of talent, a lot of advancement, a lot of sophistication and skills embedded in our development. That is for Nigeria. Now let us look at the word health. It's important to note, like I said, the advancement in our healthcare system. Now we've had about 13 major epidemics globally, but none has been associated with Africa. None has been associated with Nigeria. That tells you the level of healthcare we enjoyed at that time. All over Europe, all over Asia, we've had these kind of breakouts. I know, but for Africa, we've not had those kind of major issues, major health epidemic or pandemic. Some would say because we're not exposed to the outside world, but it's beyond that. It also attests to the level of sophistication of our healthcare. So talking about healthcare, the Oxford Dictionary defines it as a condition of a person's body or mind. The Medical News Journal extends meaning to include complete emotional, mental, and physical well-being. This meaning is recognized and upheld in many ancient and modern international statutes and conventions, including the Magna Carta, the first recorded social contract between those who are in the leadership and those who are led. The Magna Carta of 1215 in Great Britain. recognized the importance of health. In the first sentence of that Magna Carta, it talks about human health. Constitutions of the World Health Organization and ILO, International Labour Organization, talks about health and the importance, the important space it occupies for humanity. Now, looking at a system, what is a system? Because we are looking at healthcare system. A system is a set of things working together as parts of a mechanism or an interconnecting network. A complex whole, that is looking at a whole, but different parts that make up the whole. That is to say, the ability to bring various independent variables together to produce a predetermined outcome. So healthcare system is the art of making various independent variables that promote human health to work together to produce a predetermined effect. So the key words here are a network, a complex whole made up of independent variables, designed, manufactured, contemplated to produce a predetermined effect. Now, looking at economic downturn, this is a significant decline in economic activity spread across the economy, lasting more than a few months due to certain reasons ranging from human to natural causes. So looking back at history, where we're coming from, clearly Nigeria has a rich history. Unfortunately, colonialism happened. The colonial masters came. First, they came to trade. They came to trade, and then before we knew it, it became trade in commodities. Suddenly became, fell apart and gave room to slave trade. Now we endured that for about 200 years or so of slave trade, or 200 to 300 years of slave trade. Then before it was abolished, due to the efforts of both Africans and Europeans who had humanity at heart and put an end to that very sad eon of human history. And then we went back to trade. But before we knew it, colonialism happened, and that was for a reason. And that is connected to what we're talking about, and it's a central part of this discussion. Now, when colonialism came, what colonialism did to our economy, to our way of life, is still part of what we are suffering today. What did colonialism do? Colonialism tried to undermine the value of both the human beings and the resources in Africa. The human beings in Africa and the resources in Africa, including the system that we're operating. Like we said, healthcare system was well managed in Africa. We had clean communities like Mr. Ofat noted in his memos that in Benin, it was such a clean city, it was such a crime-free city, it was such a healthy city. Basic hygienes were kept and the people were healthy. But then the colonial master said we didn't know what we were doing. And they began to, before we knew it, Nigeria became incorporated when the outbreak, there was a particular outbreak in the 20s, just about the time of the First World War. And we saw that Nigeria was part of it. Of course, we had been connected to the global community, but beyond that is the fact that there was no system to checkmate that, which was unlike what we had in the pre-colonial times. Like Chinua Achebe would say, he said the white man is very clever. He came quietly and peaceably with his religion. We were amused at his foolishness. We taught him to be naive, and we allowed him to stay. Now he has won our brothers, and our clan can no longer act like one. He has put a knife on the things that held us together, and we are falling apart. Granted, colonialism brought about certain kinds of exchange of information, exchange of values, exchange of value system, exchange of perspective of worldview. But then also, we are concerned about the kind of knife it waged in not just among the unity in the African communities or between Africans, between compatriots, but also the weight it put on development, on our natural progression in development of our own indigenous technology, indigenous systems, the kind of wage that it put on it. So for us, it's very important for this discussion because we see the impact of it up till now in our healthcare system. Up till now, we can see it in our economic system. So when we talk about the current economic downturn and the comatose state of our health system and other social services like education, like social welfare and all that, we can link it to the deceit of the white man produced in the iron mill of mercantile imperialism, which is cleverly wrapped in neoliberalism, that is actually neocolonialism, which has put a knife on our economy and our way of life and caused everything to fall apart. The truth of the matter is that you can take several instances. Apart from Benin Kingdom, we have the Kilwa Kingdom somewhere around Mombasa in Kenya, where there's the same documentary about a great city, a city of advancement, a city that was well planned, a city that had great development, both economically, socially, and otherwise. That the Europeans came and met these cities that were well governed, well administered. But then They just banded, that lie that Africans are primitive. Africans need to be civilized. Who needs to civilize Africa? Africa was already civilized. We had ancient civilization. We can even date it back to the time of the Great Pyramid of Egypt. Who built those pyramids? It was Africans that built them. So nobody should tell us that Africa was not civilized. Africa has always been civilized. Maybe it is those who actually came to use violence, use the weapons of coercion to tear us apart, that we should actually be teaching what civilization is all about. So, but be that as it may, let us make progress. There is an Igbo proverb that says, if you don't know where the rain started beating you, definitely you may not know where you got right. And that is our biggest dilemma at this point. Because at this juncture, we need to pick up what I call consciousness. We need to really know what happened to us. Like Socrates said, he said, man, woman, know thyself. It is time for us to understand, where did this rain started to beat us? Where did we start encountering this dislocation in our systems, so that we can be able to holistically administer prescriptions that can take us out of the quagmire? So it is important to look at consciousness. Africans must be conscious. We cannot discuss the issue of economic downturn. We cannot discuss the issue of challenges in our healthcare system in the vacuum. There must be some element of consciousness to it. We need to understand where we have gotten it wrong, where we have not been able to measure up, where we have actually missed our mark, and then begin to retrace ourselves to be able to address some of these issues. So for me, the failure in properly appropriating who we are as an innovative, thriving, vibrant, buoyant, and confident people, with deep respect for the values of dignity of labor, decent work, egalitarianism, the common good, all embodiment of our communal socialization, have further worsened our sudden exposure to the unwinding forces of capitalism, liberalism, and globalism. That is what we are suffering today. Africa was suddenly introduced to a system that it had not tested, to a system that it wasn't used to, and then because we had also people who inherited political leadership from the colonial masters, who didn't have clear consciousness, who didn't have clarity in terms of social organization. And they began to look at the field is green on the other side. And then we started having all these problems, including what is happening in our health system. Now what are the colonial mentality that we need to point out? First of all, is that, like I said earlier, the colonial mentality, the colonial system undermined and undervalued Africa and African systems. It undervalued labor. Now look at what is going on with our healthcare system. Look at the kind of wages our doctors are earning. Look at the wages that our nurses are earning. Look at the wages that our politicians are earning. And I will surprised that we're having brain drain in the country. Many of our people are moving from here to other countries to offer their services. Now, this was a system that was planted by the colonial system. One of the issues that stands out clearly is the issue of wage disparity. The amount that the district officer is was far lower than the amount that the African administrators pay. They introduced wage disparity in order to undervalue, to tell Africans that there will be lower pedigree than them. And we are still sustaining it today. Look at our political class. Look at the kind of money they are earning. Look at all the issues happening with the National Assembly. Look at the kind of budgets that they are flouting in our faces. Now, these are the issues, because we have not been able to understand where this rain started to hit our head. So what we see today as the downturn in our economy and the challenges in our health sector has a historical nuance. It has a historical, it can be historically contextualized. So we are looking at the issue of how can we learn from history? How can we learn from what happened to us? How can we integrate the concerns in the health system with the broader political questions, with the broader economic management questions, with the broader leadership question, because this is a leadership initiative. How has leadership contributed to the failures we are seeing both in the economy and in the healthcare system? I must make that point, ladies and gentlemen, that the current sordid state of our economy and the shambles in our healthcare system are largely man-made. Somebody said everything rises, I think it was John Maxwell, everything rises and falls with leadership. So unfortunately, we had people who took over from the colonial masters who were not attuned with the aspirations of the Nigerian people. And somebody said, oh, we got independence at on a free bargain. That's why things are happening the way they happen. I say, no, the independence of Nigeria cost lives. Workers pay the price. I remember the November 18 massacre, 1949 massacre in Ifa Valley in Enugu, where we lost 22 workers. They were gunned down one by one. We have their names because they resisted colonialism. Because they say, pay all decent wages. They say you cannot be paying yourself so high and paying Africa so little. So this resistance has been there. People pay with their blood. Unfortunately, our so-called statesmen who took over after independence, not many of them shared this vision. Maybe a few of them, but not many of them. And the degeneration and deterioration continued from one government to the other. From one government to the other, we have continued to transfer this new colonial mentality, new liberal mentality, always copying the white man, always pursuing the white man, even without even understanding the roots of his own civilization. Meanwhile, we have a rich history where we are coming from. We had roots, we had innovations in medicine. We had people who were setting bones. We had people who were doing midwifery, and they were successfully delivering children, babies. You know, and what did you do with all this knowledge? What did you do with them? We just took them, we just relegated them to the background, and we're pursuing the white man. I'm not saying there's anything wrong in copying. After all, there is socialization even in development. You can learn from different cultures, but you cannot abandon what you have. You cannot just copy everything without looking at what is good for me and what is bad for me. We have inherited the bad ones. We have copied all the bad examples. Even the good examples, we have abandoned them. And that is the challenge we are facing today. So, ladies and gentlemen, we must look at history to teach us what we need to do. So, over time, we have seen the perpetuation of neoliberal and neo-colonial mindsets in Africa and in Nigeria, especially by our ruling elites. You wonder, are they attuned with the aspirations? Are they attuned with the history of their compatriots? The rich history of Nigeria. We were a proud people. In fact, I'll give you an example. During the colonial rule, the white man, the British people were importing slaves from Ghana. They were getting slaves because Nigerians refused to bow to them. Nigerians refused to work for them. They were inviting people. They were incentivizing people, bribing people to leave villages to come and work in the newly developing urban centers. But Nigerians refused because they felt life was better in their own local communities. They had to get what they call the crow laborers. It's in history. There were many people from outside Nigeria, and they were inviting them to come and work because Nigerians were not ready to take those kind of work which Nigerians saw as beneath them. But see how things have changed. Unemployment has taken over the place. A once proud people have been so humbled, have been so humiliated rather, that they can even take any kind of job. People are even scavenging, looking at scavenging through dustbin to get food to eat. That is where new liberal mentality, new colonial mentality has brought Nigeria to. And when we talk about this, how does it affect the economy? Even in the management of the economy, what did the colonial masters do? They built infrastructure from the communities, production centers, straight to the ports, because what they were doing was expropriation. They expropriated our wealth. They placed cheap value on our resources. And the same is continuing today, because they didn't want value to be added to our economic centers. They didn't want value to be added to our production. They didn't want Nigeria in fact, Africa, to lift ourselves up from primary mode of production to secondary and maybe tertiary mode of production. And that is what we are suffering today. So the challenge for us now is to see, how do we correct these colonial mindsets? How do we change? Because this is the cause of the current economic downturn. Take, for instance, the issue of petroleum. Nigeria is the sixth largest producer of crude oil. It used to be the sixth largest before vandalism and criminality took over. As we are talking today, Nigeria is the only OPEC country that, especially the legacy founders of OPEC, that cannot refine her crude oil. Maybe until Dangote comes fully on stream. And why are we even looking up to Dangote when we have 4 public refineries? None is working, because we have adopted the same mindset of the colonialists, where they just take raw resources, raw materials. They take our economic resources. They take them in raw form and transship them to abroad, take them to abroad, where the values are added to them and later brought back to us to purchase at a higher price. That was what the colonial masters do. That is the same thing that what Professor Noli called the petty bourgeoisie. The petty bourgeoisie in a political class and a military
collaborators. That is the same thing they are still doing today. We carry crude oil, we take them to abroad, we take them to refineries in Singapore, we take them to refineries in Holland, we take them to refineries in the US, and they are refined, their value is added to them, and they are brought back to us as refined products, and we buy them at a very high price. Is that not the reason for the current economic downturn? When they say subsidy gone, transferring failure of governance, failure of our leaders to the citizens. So these are the issues that we are facing. And it's important that we are conscious of these matters. The economic dislocation we suffer today is not natural made, it's man-made. It's a leadership problem. Our leaders have not been able to take up the mantle, the challenge, and say, look, we are going to develop our space. Nobody will develop this country for us if we don't act. And the same thing has cascaded to the healthcare sector. By way of rounding off, I will begin to talk about how has this affected the healthcare system in Nigeria. Now, the effects are very glaring. Huge disease burden. Contrary to the objectives of our national health plan as far back as 1946, we are still having a huge disease burden in Nigeria. Ailments that have been taken care of in other countries, things like malaria that other countries have dealt with, other continents, is still a big challenge to us in Nigeria. Up until about 2 or 3 years ago, the polio issue was still here, very rife here. Nigeria was about the only country that still had it, and we became a threat to the whole world. So we have a high disease burden. A World Health Organization country cooperation strategy report indicates that the maternal mortality ratio in Nigeria stands at 814 per 100,000. Mortality rate for infants and children under 5 years was 70 and 104 per 1,000 live births, respectively. So you can go on and on. The one that shreds my heart is the fact that apart from maybe a country like Chad, Nigeria has the lowest life expectancy in the world. That is an insult to Nigeria with our resources, with the kind of money we have in this country. And I must say it, Dubai was built with only $104 billion. The major infrastructure that has made prop Dubai up as one of the destination countries of the world, or destination cities in the world, it's a city inside the UAE. Tells you clearly what we have done with our resources. According to a one-time UNODC chair, he made that point that between 1960 and that is Mario Costa, between 1960 and 2012, Nigeria had more than $400 billion have been fleeced from our national coffers, because our leaders have a neo-colonial mentality. They believe in developing other countries. They don't believe in their own country. They believe siphoning the money and taking them to abroad, to different countries in Europe and Asia is better than plowing the same money in their country and using the money to develop their space. That's why we have all the challenges, all the issues in our healthcare system. Perennial underfunding, inefficient management of financial resources for the health sector in Nigeria. Those are the challenges. Underfunding because they say there's no money. Where is the money? The money is being looted. Others use their own money to develop their country and make their citizens stay in the country. We have many countries in Africa where they have their passports are so empowered they can go anywhere in the world. And the people don't go because they are confident they are okay in their country. Instead, it is Nigerians that will go to those countries and adopt the passports of those countries and use their passport to travel. We have come to that low in our country. And I think we should begin to ask questions. We should begin to ask for redirection. So we have so many other issues like poor uptake and adoption and use of technology. Because these things are rooted to both initiative, both the will, political will to do the needful, and also the money, the finance. Or poor uptake of technology. We are still cutting wombs open when people are now using laser to go and they discover what the issues are. Nobody needs to cut anybody open again. All kinds of technology are available, including technology that can even create artificial wombs. Some of these things are already available. Other countries are toying with some of these ideas. But where are we? We are still struggling with paracetamol. We are still struggling with how to differentiate between the fake one and the correct one. That is the kind of quagmire that political irresponsibility has brought upon Nigeria. And then we can go on and on. Poor infrastructure and equipment for health. The equipments are not there. And doctors, some of them would even want to stay back, despite the poor wages, if the equipments are right. For them, it's a calling. But even the callings, their commitment to their calling, to the medical calling, is frustrated because they don't have equipment. They see how frustrated their ability to deploy their talents are being, every day they encounter all kinds of difficulties because there are no equipment. Healthcare centers, where are the primary healthcare centers, which is the foundation of healthcare system? Many communities don't have healthcare. Many local governments in Nigeria don't have viral healthcare centers. What you have is that you have where you find them. Their roofs are not there. Human beings are not there. Ghosts are there because there's no commitment to developing our country. And so many other challenges that we find. Poor resourcing for human health and imbalances in human resources for health. Here we begin to talk about issues of workers. Workers are not even allowed to unionize. Workers are not allowed to express themselves. They are always guarded with fear. They are always coerced. They are always put under pressure. If you go on strike, we'll sack you. If you don't go on strike. Meanwhile, the conditions that push workers to go on strike are created by those in government. When they sign agreement with health workers, they cannot even keep them. And they put them always under pressure. The few ones who have even volunteered to stay back, who could have traveled abroad. I don't know what our leaders wish for our healthcare system, whether it is a complete collapse, because that's where we seem to be headed for. There's something must really need to change. What has it brought upon us? Capital flight through international medical tourism. We spend billions on international medical tourism. We go to India. We go to every other country in the world except Nigeria. Meanwhile, in the 60s, some of our healthcare facilities, facilities like the Ibadan College of University Teaching Hospital in Ibadan, and many of our teaching hospitals, we are global centers of excellence. People were coming from Pakistan. People were coming from India to come and take healthcare in Nigeria. Now the reverse is the case. How the mighty are falling. What is the way forward? In conclusion, what is the way forward? We must reject and reverse neoliberal and neo-colonial mentality. Africans have what it takes. We had great civilization. I will give you an instance as I conclude. There's a man called Henry Cort from Great Britain. He was a great industrialist. Henry Cort was acclaimed to be the founder of iron smelting, the iron smelting technology. But history has it that clearly this technology he copied from Africans that were sold as slaves in Jamaica. He went to Moran Bay in Jamaica, somewhere in Jamaica, and he pirated. I'll call it pirated. He pirated this technology from Africans, and he would win them, to come to Great Britain and use them to start, the smelting technology that was one of the great contributors to the Industrial Revolution, not only in England, but also in entire Europe and by extension, the entire world. This technology was owned by Africans. By Africans. So when they tell us we have no value, we should tell them our history, where we're coming from, that we are far more sophisticated, and we need to have leaders who think like that to be in the helms of leadership in our countries. Second one is that we must go back to the days of national development plans. All these ad hoc measures of 7-point agenda, 13-point agenda, 20-point agenda, they are just wishy-washy. They don't address the root of our problem. When a government goes, the whole plan goes with them. Another one will start planning a different 10-point agenda. They don't address the issues for a country aspiring to be a developmental state, such as Nigeria. A developing country like Nigeria should have development plans. That was what we had in the 60s. A long time gestation period for development. We make plans, we allocate money for it, and then in accordance to our projections and aspirations as a country, we need to go back to the days of national development plans. Finally, we need to take political action. It was Bertolt Brecht that made this very epochal statement. He said it is only the politically illiterate that does not understand that the shoe he wears or she wears, the coat on his or her body, even the food he or she eats, are products of political decisions. We are all products of political decisions. So we must be interested in who rules us. We must be interested in who wields political power over us, because what they do will shape our lives. Unfortunately, during the last election, despite all the conscientization, all the mobilization that took place before the last election in 2023 in Nigeria, I can tell you that it turned out to be the worst in terms of voter turnout. Nigerians, Many Nigerians still refuse to come out and vote. In fact, it was labeled to be the worst in Africa. What are we doing? We must take interest in politics. Workers, mobilize yourselves. Professionals, mobilize yourselves. We cannot keep complaining. It was Kwame Nkrumah that said, Africa, stop agonizing. Start organizing. Let us organize politically. On the day of election, let us come out in full mass and begin to elect people who have a different mindset of development, Pan-Africanism, mindset of freedom, economic emancipation. Let us get those ones in power, those who understand what it means to develop a state, so that the labors of our heroes past will not be in vain. In terms of healthcare, I will say we will need to improve on technology, adoption of technology. We need to adopt technology. Yes, what is going on in the world. Expand our ICT infrastructures, reskill and upskill healthcare professionals on the use of e-health consumables and services, foster relationship between our healthcare system and healthcare original equipment manufacturers to get equipment in to help our healthcare workers who are ready to deploy their talent and their skills in helping humanity. We must reject human resources for help. Workers must earn living wages. It's only when workers earn living wages in Nigeria that they will stop going abroad. That is only when we can turn the brain drain to brain gain. That's when our professionals will have the confidence to begin to come back. We must respect, government must respect collective bargaining agreement. Instead of criminalizing strikes, let government criminalize failure to implement collective bargaining agreements. Let government criminalize failure to pay workers. That's what government should be criminalizing, and not to be criminalizing those who are complaining about the malignant and irresponsible failure to pay wages. Every worker deserves his wage, even the Bible says so. Put square pegs in square holes by appointing the right head personnel to man the administration of healthcare in Nigeria. Then on a broader scale, I'll end with saying, let us strengthen the governance structure of healthcare delivery in Nigeria. Let us make sure that we mark health, we should respect constitutional provisions that makes health a fundamental human right. Federal government, state government should respect the provisions of national health, which prescribes allocation of 1% deduction from consolidated revenue for healthcare. Let us improve health financing to guarantee universal health coverage. Let every Nigerian be universally covered by some kind of health insurance. Whether you're a worker, whether you are out of job, that's what other countries have done. They've done that to be able to temper society so that people are not unnecessarily agitated. Some of the crimes we see is because people are agitated. If I fell sick, what will I do? If my mother fell sick, what will she do? If this one, it's all this tension that has led to high proliferation of crime in our society. We can solve these things by taming the surging tension in our society by guaranteeing access to universal health coverage. Implement social protection policy to take care of issues such as nutrition, education, and all the things that are also ancillary to health. Strengthen the primary healthcare system because that is the foundation. Tackle corruption in the health sector, ensure transparency, accountability, value for money, effective monitoring and evaluation of all health sector funded projects, and very importantly, this menace of drug counterfeiting must stop. Must stop. Government must wake up to its responsibilities. We cannot be the only country that we're always dealing with counterfeiting of drugs. You go to pharmacies now, you don't know which one is real, which one is fake. That must be put to a stop in Nigeria so that our people can have access to quality healthcare. Thank you for listening to me. We must remember the job of repositioning the healthcare system amidst the current economic downturn is a job for all of us. Let us all make it happen. Thank you once again to Rite Place for inviting me and giving me the opportunity to share these thoughts of mine. Thank you and God bless.
Thank you, Comrade Eche, for that powerful presentation. It is not difficult to hear his voice laced with his passion for his country. It is very clear and evident. It is evident from his presentation that the healthcare system in Nigeria is sick. So one would ask, what is the state of health of the Nigerian healthcare system? So we can see that it is suboptimal. And the suboptimal nature manifests in the issues that he has listed. Of course, most of us are familiar with the lack of infrastructure, even personnel, equipment, the lack of the adoption of technology. So from all indications, Nigerian health system is left behind. And so a lot of our healthcare professionals are looking for better life elsewhere. Everybody, well, most people are looking for visas to go elsewhere to practice. And then that leaves the country even worse off. So the question is, what shall we do? Now that we are aware of the issues and the challenges given our situation, what shall we do? Leadership is needed. So government needs to rise up to this challenge and make policies and implement them with the purpose of reversing this trend. If current trends continue, we are heading in a direction that will spell doom for the country. And of course, for Africa as a whole. He reminded us that Nigeria is the largest Black country in the world. So whatever affects Nigeria affects Africa directly and indirectly. So if our government does not hasten up and address these issues, not only will our health indicators worsen, a lot of external effects and the externalities are going to be recorded by reason of this decadence, and that is not good. So there should be more investment in the human resources for health. There should be implementation of and adoption of technology in the health system. But more than anything, our human resources should receive befitting wages, decent wages, wages that are good enough to support the average human being. When your contemporaries make overseas per hour what you make in a month, that is not fair, and that is not acceptable, and that is inexcusable as well. So there is no reason for us to try to even justify or to excuse the issues. Something has to be done, and done very quickly, and which is the whole purpose of this meeting, because we want to bring to the fore issues that need to be addressed and addressed very quickly. So we use this medium to call on whoever has the ears of government to remind them that health is important. The healthcare system is very important because that also affects the economy, and the economy affects health and the healthcare, and they are all intertwined. And so one cannot be trying to address one while ignoring the other. Does anybody have any questions for Comrade or for myself as we begin to round up? Thank you. In the absence of any questions, then let me thank you again for calling in. Don't forget the topic for today was the Nigerian health system in an era of economic downturn. Look at the issues, the challenges, and the way forward. So we appreciate the fact that you called in, and we look forward to our next call next week. Same time, same venue, same channel. Have a nice weekend and bye for now.
Good night.